Do you want to learn some strategies to stimulate referrals in your dental office? Hi, I'm Dr. Germán Gomez and I'm in Valencia, Spain. And today we will talk about how to stimulate referrals, what usually happens, and you will learn also strategies to increase referrals, and how to handle a no if somebody doesn't want to refer to you. So how to handle that. So what happens usually, or what usually happens is, where does most of your business come from? Usually it's referrals. Now, most dentists' strategy is this. First, they hope. But hope is not a strategy. So they hope that people will talk about them and people will refer to them. Okay? But hope is not a strategy. Second, if you know somebody who needs my dentistry, please let me know. This is what they usually say to the patients. Okay? So there is an action, which is good. But if the patient says, well, I don't know anybody right now, then what happens? Beep. Nothing happens. Nothing fast and continuous happens. So what strategy should you go? Strategy number one is avoid the word referral when you are asking for referrals. Okay? So instead of referrals, use the word introduce. Okay? Could you think of some friends, colleagues, or family that you could introduce to me to? Strategy number two, ask for permission before you even treat them. Okay? So, first time the patient comes in, you set the expectations. Your expectations is that this patient, it's a new patient, will refer to you patients later on. So, and you say that from the beginning. So, at the beginning of the relationship, Mr. Patient, my purpose is to help you to become so happy with the treatment that you would gladly introduce me to at least 3 people you really care about. Or, Mr. Patient, I want you to be so delighted with the treatment that at the end, I will ask you to introduce me to at least 3 people you really care about. Does that seem fair enough? And then, well, he knows that you will do anything possible to make him happy, which is good. And in return, he gives you referrals. Of course, you would do that anyhow, trying to make him happy anyhow. But now he feels like he needs to give you something in return. Now you have set the tone. Strategy number 3, imagine you have ask for advice instead of referrals. Imagine you have a highly successful patient and you want more of these celebrities, soccer players or American football players or basketball players or something like that, okay? And you want more of these patients. Sometimes they're not comfortable being mentioned. So they don't want you to mention them because they have contracts with advertisement companies and so on, and you cannot mention them. It happens to me a lot, by the way. So what you do, so if you ask directly, they feel like uncomfortable. You say, oh, can you introduce me to some more soccer players or to some movie stars or something like that. So they don't like that usually. So you have to go another strategy. So what do? You ask for advice in 3 steps. Step number 1, acknowledgement. What does that mean? Mr. Patient, I want to sincerely thank you for your confidence in us to help you design your new smile, and I'm truly grateful. So you acknowledge the patient for being your patient and for his confidence. Step number 2, put him or her in your place. So imagine you were me and run a dental office and you want to help more people like you, highly successful patients. and you would love to work with people who are introduced by good patients. Step number 3, ask for advice. I'm curious, what would a successful person like you do to encourage people like you to introduce their friends, colleagues, and families to you? These are highly successful people. They will come with ideas on the spot. So you have to implement these ideas. You do it, and you do it on them. So now it is difficult for them not to introduce you to their environment, because it was their idea to proceed the way you're proceeding on them in that moment. So they gave you a tip, you do it on them. Does it work? You told me. Okay, so then they would have to refer patients to you. Okay, strategy number 4. What if the patient says, no, I don't want to refer? You don't want to refer when the patient says no, when you ask for referrals. Strategy: find out what has to happen. Okay, Mr. Patient, I would love to be the person who you would feel comfortable introducing to your friends and family. Notice, I do not use the word refer. I use introduce. Let me ask you a question. What should happen now in order to make that a reality? Or, so take notes and then let them talk. So what has to happen? Or, okay, Mr. Patient, let's pretend I do A, B, C that you suggest. So would you be more comfortable to introduce 2 or 3 of your friends to us? Well, sure. Then yes. Boom, you got it. Okay? So that's the strategy you have to go. That's how you get referrals. You don't hope. You don't wait. You proactively use words. You use a script, the script that I just presented to you. I hope this video was helpful for you. Thank you very much for your attention. Please subscribe to this channel. Click on the bell, turn on notifications, like this video, share this video, and comment below. Bye.